The summer season is just about upon us, and people will be heading to the beach and backyard pools to take in the sunshine. But the risks of being in the sun without protection are real. Carolee McGrath sat down with Dr. Richard Arenas, Chief of Surgical Oncology at Baystate Medical Center, and John O'Brien of the Bax and O'Brien Show on Rock 102 to talk about John's personal battle with melanoma.
Let's see, in 2012, I discovered accidentally almost a spot in the dead center of my back, and I was seeing a dermatologist anyway, so I went to him and he took a biopsy of it, and within a couple of days I was notified that it had come back positive as cancerous melanoma. So I had Dr. Arenas perform surgery, and they did a test to find that it had also spread into my lymph nodes. But then I went on treatment for 9 months of interferon, which was described to me as all the fun of chemo without losing your hair. And it was all that. And went into remission for about a year. And then all of a sudden it came back again. I was continually being scanned and going to the regular oncologist. And within a year, they realized it had returned, and now it was in my lungs. And so I went in for a second surgery, which was thankfully very, very small spots in the lungs. And I was lucky enough to get into this immunotherapy almost from the ground level. And they say for the people that it works for, it's astounding how well it works. Unfortunately, it works still for a minority of people, but it worked for me. And within a year, 2 years rather, of a treatment for that, I'm back in remission now.
What stage was it?
Stage 4.
Stage 4.
Yeah.
So this new therapy that he was on, first of all, talk a little bit about the therapies that have come out in recent years to help people.
So John started out with a therapy that was around a very long time called interferon. And like he said, it was a very difficult therapy to go through because it's about a year of treatment, and the results haven't been all that great. But then in light of this new area of immunotherapy, there are newer drugs now that actually can alter the body's immune system and target, in many ways, cancers. Initially, it was showing very good promise in melanoma, but it's now being used in other cancers as well. And literally what it does is it goes in and turns little switches back on in your immune system and allows your immune system then to carry on and hopefully get rid of all of the cancer cells that may reside in the body.
And can you explain what melanoma is? I know it's skin cancer, and can you compare it to other forms of skin cancer as well?
So if you think about the cells of your skin made up of different types of cells, the cells that give you the complexion or the color, those are the pigmented cells. We call them melanocytes. And it's cancer of those melanocytes that actually is melanoma. And it's one of the more deadlier forms of skin cancer because of the fact that melanoma can metastasize or spread.
So have the rates gone up? I read somewhere that the rates have gone up, which actually surprised me because you always hear, put on sunscreen, put on sunscreen. Why is that happening?
So the rates are going up for skin cancer in general. And I think melanoma being one of the types of skin cancer, we're seeing increasing rates as well. There are two reasons. The population is getting older, we're living longer, and because our skin being a natural barrier to our environment, it just shows to prove that there are going to be increasing number of skin cancers, including melanoma. But we're also seeing an increase in younger people. And in fact, melanoma, if you look at death rates by cancer in the 20 and 30-year-olds, the number one cause is melanoma. So the question is why? And some people feel that it might be behavioral changes. Are we spending more time in the sun? Are we not using good judgment? Obviously, there's the concern about some people using tanning salons, which essentially increase the amount of exposure to ultraviolet radiation. But it doesn't explain everything. And I think one of the concerns is, are there environmental factors that may be sensitizing our skin, altering our skin so that we're more sensitized to the changes that may be occurring with exposure to the sun? And could there be atmospheric changes going on? So I don't think there's one particular cause. I think there are many causes, but we're definitely seeing an increase in melanoma.
So way back when, I remember, because I can say this, way back when, you used to put oil on when you would go out in the sun. I mean, it was just, you think about this and it's just so dangerous. Before this happened to you, did you pay attention to being careful?
Well, like I say, I was under the care of a dermatologist anyway. I was never a sun worshiper, but being a pasty white Irish guy, I can tan basically from a 110-watt bulb. So that didn't help any. And I, as a teenager, had issues with acne that is part of the reason why I was going to the dermatologist. But no, I didn't put suntan lotion or sunscreen on all the time as a kid, but I also didn't really lay out in the sun. I think it was just probably normal exposure, and I almost never went shirtless outside, so who knows exactly where it enters or how it gets there.
And what do you advise for people? What are they looking out for as they're, just, checking their kids or just making sure that everyone's safe? What are we supposed to be doing?
So you hear about something called the ABCDEs when it comes to looking at moles, because obviously one of the concerns is if you have a mole or a pigmented skin lesion, not all of them are going to be melanoma, but if you see it changing, and so, if there's if it's an asymmetric type of skin lesion or a mole, if it has irregular borders, and if it's changing colors, or if it's growing, increasing in diameter. But most importantly is the fact that if you have any skin lesion that's changing or evolving, that's the E, you really have to bring it to the attention of your primary care provider, and if necessary, they'll refer you to a dermatologist. One of the things I've been really trying to push is the fact that we see a lot of patients who have skin cancer or melanoma, and they be going to the doctors for regular checkups. So I encourage patients to be their own advocate and say, when they go see their doctor, ask them, say, can you take a look at my skin? Don't be afraid to disrobe in front of your doctor and have them look at your skin. And have someone, who you trust close to you that can look in areas of your body that you just can't see.
Right.
That, by the way, is also a great way to teach children the alphabet and scare the heck out of them at the same time.
So I'm married to an Irish guy. But seriously, why did you feel this was important to share your story with others?
It was one of those things where it happened, and I've always been pretty open on the air with my personal life. I went through a divorce, and that was part of the show. And subsequently, after the cancer, a few months ago, I had open heart surgery, and that was a thing that created awareness as well. In fact, I think I actually created my own monster, because the ability now to get an appointment with a dermatologist can sometimes be months out. And I know mine had said to me that after I was treated the first time for melanoma, he had a number of people calling saying they had listened to our show, they had a spot that they had been kind of ignoring for a while, and now they wanted to have it looked at. And he said, in fact, one person had the same thing I did, and when he was informed that he had to have surgery, he said, "You mean I have to have John O'Brien surgery?" It's not Tommy John, but I guess to have your name put on a surgical procedure is kind of an honor.
But you're making people aware, and I think certainly your audience too. Like, hey, guys, you got to. Of course, there's women who listen to you as well, but you got to really, take care of yourself, and these are serious things to look out for. Thank you so much for coming in and sharing your story, and thank you for being here as well. And we wish you all the best.